Hello, everyone. Today I will be talking to you about socially surviving COVID-19. I'm Dr. Charissa Pizarro, and we will be discussing some simple tips to survive and cope with this 2020 pandemic. Before we discuss the COVID-19, I want to talk to you about the pandemics across history. We're going to start talking about the most recent and work our way backwards. The first pandemic and most recent is the HIV/AIDS pandemic, which was at its peak in 2005 to 2012. There was a death toll of 36 million from the HIV/AIDS pandemic. Continuing backwards, there was the flu pandemic of 1968, which was also called the Hong Kong flu, and it was with the strain H3N2. The death toll for that pandemic was 1 million. It is followed by the Asian flu of 1956 to 1958, and that was the strain H2N2 strain with a death toll of 2 million. The flu pandemic of 1918 to 1919 was the H1N1 strain, and there was a death toll of 20 to 50 million around the globe. This pandemic did not discriminate who it killed, and it had a mortality rate of 10 to 20%. Killed young and old, and it happened after World War I, so it spread very quickly around the world. And that's when the flu vaccine was also developed. So this pandemic is especially important. I have a newspaper here from around that time, and it's from the Jersey Journal. This pandemic was approximately 100 years ago, and if you look at it, it's almost as if history repeated itself. It's very similar to what is happening now. It's talking about school closures. The state called on every physician and nurse. Ways to escape the influenza are some of the headlines. Influenza hospital in Greenville. So it's very similar to some of the headlines that we have today. It's a little eerie, actually. Pandemics continued. Again, remember that we're going backwards. The next one is the sixth cholera pandemic, and that's from 1910 to 1911 with a death toll of 80,000. Next is the flu pandemic of 1889 to 1890, and that's the strain of H2N2, death toll 1 million. The third cholera pandemic is in 1852 to 1860, death toll is also 1 million. And then we have the bubonic plagues. There was the Black Death in 1346 to 1353 with a death toll of 75 to 200 million. The plague of Justinian, also caused by the bubonic plague, and that was in 541 to 542 with a death toll of 25 million. And the Antoine plague in 65 AD with a death toll of 5 million. The cause is unknown. And that brings us to present day, COVID-19, which you have probably heard a million times, began in Wuhan, China. It came from meat and seafood market, allegedly from the meat of a bat. So it was transferred from an animal to a human. It only existed in animals previously, and now it's being transmitted from human to human. Despite the quarantine efforts in China, it has spread globally. Other coronaviruses that we know of are in the MRSA virus and SARS. And just an interesting fact, the coronavirus is called such because it looks like a crown, the actual virus itself. And crown is corona in Latin Spanish roots. And it was discovered in 2019, hence the 19. It was discovered in December 2019. And the symptoms for the COVID-19 are fever, cough, shortness of breath. Those with a weaker immune system may develop pneumonia and bronchitis, and the virus is spread through droplets and cough or through touching. Since it is spread through touching, we are asked to do frequent hand washing with soap and water and avoid touching our face, our mouth, our eyes. We are also urged to use hand sanitizer if there's no water nearby, and the hand sanitizer should have at least 60% alcohol. Something else to prevent the virus from spreading is self-quarantine, and that's for the safety of ourselves and our family, especially the elderly. So, as part of the self-quarantine, we are to maintain a social distance from others of at least 6 feet. Some suggestions when dealing with children and the topic of the coronavirus is to tell them only what's necessary and age appropriate, but do maintain an open communication. Have your children limit their use of social media and news watching. Social media in general and news watching is detrimental, it's stressful, and very anxiety provoking. Prevent binging on Netflix now that they're home. I know they have schoolwork, but they probably have a lot of downtime. There are better ways to spend their time. Netflix, TV, video games, they're probably trying to use their time on that. It's best to limit that time. Try to maintain structure in the home, develop a schedule, have them do certain things at the same time every day. Keep them active, and try to be honest. We don't know how long this will last, but it will be over. And this is also a great time for family time, and it's a unique opportunity you may not be presented with again. So it's about reframing. It's about how you look at things. This is not something that we want, of course, but since we can't help it, we might as well make the best of it. Spend time with your family, communicate, do things that you wouldn't otherwise have time to do. Surviving the quarantine. Most people at this time are working from home, unless they're essential workers, doctors, nurses, people at pharmacies, restaurants. So most people are working from home. Children are temporarily being homeschooled. The social isolation does not mean you need to isolate yourself completely if you are one of those people at home. Stay in touch with family and friends. You could do phone calls, FaceTime, use social apps, do check-ins with elderly family members. The elderly are a population that is at very high risk. They're physically at risk with the virus because their outcomes are more negative. They are also at risk socially due to loneliness because they're not only more prone to being isolated, they were before all this happened, but they're also more prone to feeling lonely, which is the subjective feeling to the isolation. So do check in more often with the elderly because this quarantine could have more effects for them in the long run as well. Have family meetings in your home with your family and keep the communication going. Do practice self-care. Although you need to complete your work, your children need to do their schoolwork, do not neglect yourself. Keep structure, develop a schedule, be sure to eat healthy, have your children help prep the meals, set the table, stay active. Some of the same thing I said for the children. And again, quarantine doesn't mean you cannot go for walks. Use your backyard. As long as you observe the social distance rules, it doesn't mean that you have to stay inside every single minute of the day. As I said for the kids, decrease the use of social media and the news because in general, this just increases anxiety and increases stress. Do fact checks on the news. Accurate information is crucial at this time. Use reliable resources to obtain your information. Some of those are the CDC, World Health Organization. And lack of control increases stress to begin with. This current situation is very fluid. We don't know much about it. So there already is in control. So just try to Control what you can, and we're going to talk more about that later. And just let go of what you cannot control. Focus on what you can control. Managing stress now can prevent long-term issues. So manage your stress now as best you can, and this will help you in the long run. So let's talk a little bit more about what you can control and let go of what you cannot control. So some things you can control. Excuse me. You can control your attitude. You can control whether you watch or don't watch the news. You can control whether you take precautions and you follow the CDC recommendations. You can control whether you maintain social distance. You can control your attitude, your kindness, your grace. You can control whether you stay on social media all day or not. You can find fun things to do at home. You cannot control what others do, their social media usage, their social distancing rule following, their actions in general. You cannot predict what will happen. You cannot control what you find at the store, the toilet paper, the water, the chicken. You cannot control that. Cannot control how long this will last. No one can. Can't control how others will react. So just try to let go of those things. It's not easy. But just try to let go of those things and focus on what you can control. And in the long run, that will help reduce your stress. Some ways to relax and manage your anxiety. Keep an eye on your thoughts and reframe them as needed. Try to keep them positive. Practice deep breathing and meditation if you can. I have here a website that offers free daily meditation for adults as well as children, and it's free during this coronavirus episode that we're having. You can keep a journal. Again, stay active, eat right, extremely important. Also, try to get enough sleep. Just because you're home doesn't mean that you can stay up all night. Talk to people. Pick up the phone. Call someone. And if you feel that you need professional help, do not hesitate to look for it. There are many professionals that provide telehealth and are waiting to do therapy with you. It is an especially stressful time for people right now. So do not hesitate to reach out and call someone to get the help that you need. We were talking about reframing thoughts. So one of those thoughts might be, for example, I'm stuck at home. Something that you can say to reframe that thought will be, I get to be safe in my home and spend time with my family. Some people are not at home. Some people are outside of home working. Another thought to reframe, I will get sick. Reframe that. I will do everything I can not to get sick, and that will decrease my chances of getting sick. Another thought, I will run out of items at home during isolation. Reframing that, I have prepared for this and I will use my items wisely. Don't waste what you have. I have everything I need for now. Focus on the present. Everything is shutting down. I'm panicking. The most important places such as medical centers, pharmacies, and grocery stores remain open. So again, keep in mind the positive. Focus on the present. And when it comes to thinking about the uncertainty, which is the reality of the situation, just again, think about what you can control and let go of what you cannot control. And try to focus on breathing, calling loved ones, getting enough sleep, proper nutrition, prayer if you have a faith, and pray, and try to do things at home. Take your mind off of it. I have provided some resources here. There's my website, drteresapizarro.com. Some articles from APA that should be of help to you. There's also a podcast on coronavirus anxiety. I find it very helpful. In the Help Center, there are some insurance questions that APA answers for you. There are also some scenarios and benefits available from the Department of Labor. This is for New Jersey. And some resources for children. There's cosmic yoga. There are some reading resources, audiobooks. Liberty Science Center has some movies. There's also some reading sites that have some free. There's a lot of freebies going around right now due to what's going on. And here are some references. There's a CDC website, World Health Organization, American Psychological Association, and some other websites you might find helpful. Thank you for listening. Best of luck, and try to focus on what you can control. And again, if you need to seek help, do not hesitate to do so. Thank you.